An overview of our outpatient program would include our assessment department. When someone comes into assessment, they would meet with a master's level counselor who they would meet with and discuss their needs specifically. They would go over their history about drug and alcohol addiction, also any mental health needs that they have, any family history, all of those types of things, and go over what they specifically need with that counselor who would determine what level of care is appropriate for them and how we can help them at Meridian. We also have an education program, which would be for someone with an addiction, where they could come in and it's a 6-week program where they receive some education about substance use, about coping skills, decision making, goal setting, those types of things. And they also get individual counseling as a part of that and drug screening. And then we have our intensive outpatient program, which is a little bit of a longer program. Individuals in that program are here typically for 4 months. They come to treatment 3 days a week, and it's a more intensive program where they receive some psychoeducation about addiction. They learn how to get in contact with the 12-step community, learn about recovery, how to make those connections, and how to prevent relapse. Anyone who's struggling with an addiction could come in for an assessment and determine what level of care they might fit into. It would depend on their need, but if they were at a level where outpatient treatment was appropriate, then they would certainly be able to participate in our programming. The program would be based on their specific needs. We kind of tailor it to the person. So if they were in the education program, it could last for 6 weeks. If they were in the intensive outpatient program, it could last for 4 months. And then some clients stay with us a little longer. It just kind of depends on what they need, what they're looking for, and what that fits into their lifestyle. Depending on the person's needs, it depends on how often they would have to come in. They could come in once a week, it could be 3 times a week. It just depends on what their specific needs are, which would be determined at the point of assessment. We accept Medicaid and Medicare. We also accept most private insurances, and we do have a limited amount of board funding where people could pay on a sliding scale based on their income and what they're able to afford. Absolutely. We try to work with individuals to work with their schedule. We have both morning and evening programming, so most people find that they are able to do all of their normal activities while they're participating in treatment. We have family programming where family members can participate. We offer it several times a month where they can come and participate in a group session, which gives them education about what they can expect for their loved one who's in treatment, what they can expect with the disease of addiction, and where they can get treatment themselves. We also have short-term counseling that they can receive for themselves to get some help and support as they're going through that with their loved one. For more information or to schedule a free consultation, please contact us at 330-797-0070.